the mental health arena is tough because there are no growth curves. There is no lab test. And a lot of it's intuition. And sometimes this happened to me twice in my career. I'm treating a symptom. I don't really know what the diagnosis is. Do you really need a blood test and a diagnosis, or are you going to let the kid develop? And with time, the diagnosis will come out. And I'm like, oh no, I need a diagnosis. I'm writing for clonidine for this kid to sleep, and I don't know what his disorder is. I'm just treating the symptom. They're like, that's totally okay. Let's see what the kid's 3 when you start treating him. Let's see what he looks like when he's 7. He may be an AD. He may not be. He may just be a sleep disorder. But you have time. I think that's discomfort that pediatricians feel. I don't have a blood test. I don't have a growth curve. I don't know what the diagnosis is. Am I over medicating or under medicating? Am I doing harm by giving this kid clonidine? And that's where I think the gut turns in the pediatrician.
There are a couple of things in there. One is there aren't blood tests, but there are screeners and questionnaires and ways that you can try to objectify. And I think we've all had some screeners and seen the limitation of screening tests to make diagnoses, but you can't follow PHQ-9 scores. You can follow GAD-7 scores. One of the benefits of doing that training with REACH or having a child and adolescent psychiatry portal is that you can talk through the case with a psychiatrist and they can give you their criteria, right? This is what I used to help me decide if a child has ADD or ADHD or depression or anxiety. It can take you through the DSM criteria and ask those kind of questions that you're going to want to ask. The other that is because in primary care, I really feel strongly that this belongs in primary care for lots of different reasons. Some I've already expressed, which is that collaboration between the pediatrician and the mental health, behavioral health specialists is much better and easier when they come to our morning huddles and they talk to us about our patients when we have our consultation call. But the other part is it helps me show families and kids that there's no separation, right? When you come in for your sports physical, I care about how many sprains you've had and whether you've had a concussion, but I also care like what's going on socially and what are the substances that your friends are using and how are you sleeping and what's going on with anxiety and stress around exams or what's going on at home. It's all part of the same thing. And I do think that it takes away the speed bumps to getting help. The same place you come for your sprained ankle is where you come for your social anxiety.
That's a perfect segue to my next question. Operations and management. Yeah. What's the first steps that we need to do?
What does he want and what does he have the resources for? So I already went through a few of the steps that we took.
You need a social worker, right? You need patients. You already have plenty of them. You need to find a screening method of what cases should go to the social worker. Otherwise, it's just a lot of acute care.
The first thing you need to do is you need to start screening.
George, that's not the data says.
Really?
Yeah.
I don't think everyone is doing it because a lot of people are frustrated by something Dr. Bravo brought up, which is, okay, so I'm going to identify all these kids with PHQs of 16, and what am I going to do with them? In the old days, I would give them a list of local therapists, and then I'd see them 6 months or a year later, and the family like, yeah, we tried, we called, nobody called us back, nobody was on insurance. They would send me lists of people on insurance panels that I didn't recognize any of the names, none of them saw kids. It was hard. So step one might be to figure out what are the resources in your community, right? For those kids with Medicaid, what are the programs that are serving them? What's going on in the schools? Sadly, the funding looks like it might be being clawed back, but there was a pretty good wellness program in our local schools with trainees and therapists that we tried to connect with and work with. So figure out what are your local resources. Start screening. If you've already done those two things, awesome. You're already providing some behavioral health. Find someone in the community who's willing to do what we started with, right? Meeting with families and helping them navigate the system a little bit. we went from that to hiring someone. We had our child psychiatrist, as I said, who was working with us and doing consultations with us. We did the co-location thing for a little bit. That was helpful, but it wasn't all the way there. Beef up the resources that are available in your practice. I already mentioned, I'm going to share a link with you that you can put in the show notes that has a folder of different resources that we use in our practice, different workbooks for anxiety, depression, ADHD that I can give families.